without answering, how many of you have actually thought about having sex? First and foremost, I want you to know that it is a totally natural occurrence and it is necessary in order for procreation. But when considering having sex, there are many things to question. Lucky for you, I only have 10 minutes. So I would like to share with you some basic facts on emotional readiness, STDs, pregnancy, and birth control. There's a vast difference between emotional readiness and physical readiness. According to kidshealth.org and womenshealth.gov, on average, girls begin their cycles at the age of 12. But there's been cases of girls starting at the age of 8, and so begins the reproductive cycle. Having started your cycle does not mean that you are emotionally ready to start having sex. Whether you base the decision of having sex on religious views you share with your family, or if it just comes down to the moment, the bottom line is, are you ready to conceive a child or an STD? Part of the responsibility of having sex is being able to talk with an adult about it. By speaking to an adult, you'll have support. They can also help guide you as to be best prepared as possible. Once you have sex, there's no going back. It's not to say that you have to have sex all the time, but that part of your life is over. You're moving on to a new cycle, so it's something to really think about. So please, take your time to consider it. Any partner that sees how much you value yourself will value you as well. Otherwise, they just may not understand value. Speaking of self-worth, let's move on to some physical facts on the matter. STDs. Sexually transmitted diseases are spread through sex, close contact, whether it be oral, vaginal, or anal. PlannedParenthood.org has a wealth of information when it comes to learning about sex. Genital warts, which is flesh-colored, soft to the touch bumps, usually painless but itchy. It's spread through close contact, skin to skin. There is treatment, but they can also go away on their own. Using condoms greatly helps reduce the chances of contracting genital warts. Pubic lice or crabs. Pubic lice or crabs are lice that live in the pubic region on a man or a woman. Like head lice, they feed off of their host and lay eggs in the hair. They climb from hair to hair. So there are ways to treat crabs, but no preventative measures will keep you from getting them other than not touching. Genital herpes. The symptoms of genital herpes are clusters of blistery sores on the vagina, vulva, cervix, penis, buttocks, and anus. It's spread through touching, kissing, and sexual contact, even from mother to child through vaginal birth. It is treatable, but you will have the virus for the rest of your life. Condoms don't really offer much protection as it affects the surrounding areas. Chlamydia, an infection caused by bacteria. Symptoms are abdominal pain, abnormal bleeding, fever, burning while urinating, swelling inside the vagina, yellowish, strong-smelling discharge from the cervix. It is spread by having sex, oral or vaginal. Antibiotics can treat the bacteria. Female and latex condoms are a good way to help prevent contracting chlamydia. When you are infected with any disease, your immune system is weakened, therefore increasing the risk of contracting more ailments. This is exactly what HIV does. HIV is a disease that breaks down the immune system, which is our body's protection against disease. Early symptoms can be swollen glands, fever, fatigue, and aches, but you may not feel these for 10 years or so. HIV is transmitted in blood, semen, vaginal fluids, and sadly, breast milk. It is spread through sexual intercourse and other ways that these above fluids can mix. Condoms help, but there have been known cases of contraction of HIV through condoms. The symptoms of AIDS, which is the final stage of HIV, are so horrendous and gruesome that I didn't even want to bring them all to the table. But basically what it does, it eats you from the inside out, slowly and tortuously. These are all reasons why, among many others, you should really know your sexual partner. You must have trust and honesty with them. Get educated and don't spread. If that has not turned you from unresponsible sex, maybe this will. Pregnancy. A menstrual cycle is the first day of flow to the first day of the next flow. It doesn't matter how many days you bleed. During the first half of your cycle, the lining of the uterus thickens and the egg matures. Mid-cycle, the egg drops, called ovulation. You are able to get pregnant. There's typically a 3 to 4 day window during the ovulation time, but according to Mayo Clinic, a sperm when ejaculated into a vagina can live up 3 to 5 days. So that means if you have sex a week before your ovulation cycle is complete, you still are highly likely to get pregnant. It only takes one sperm to fertilize an egg, and one sperm can exit the penis before ejaculation. With all in this in mind, there are many ways to protect yourself. Unless you are Mother Mary, the only true form of protection is abstinence. But depending on how much touching is going on, you can still contract STDs. So we'll talk about a little contraception, birth control, and help to prevent STDs. Female condoms is a pouch inserted into the vagina that helps prevent pregnancy and lowers the risk of STDs. Latex condoms are used on males. There's implants, patches, pills, shots, vaginal rings, cervical cap, diaphragm, the rhythm method, IUD, morning after pill for emergencies, spermicide, sterilization for women if you never want to conceive, and the sponge. So now that we have gone over some basic facts of STDs, pregnancy, and birth control, it all comes back to you. Are you really ready? And how do you know if you're ready? And is your partner ready to take on the responsibility? All questions that there are answers to. Do you want to face the possibilities of STDs uneducated? To not feel alone? Do you have an adult to talk to? Are you ready to take on the responsibility of pregnancy, birth, child rearing, adoption, or abortion? Sex is something I want you to be ready for, to enjoy and to celebrate. I want you to be able to wake up the next morning and be happy because I love you all.